17 on your Wednesday or Tuesday morning. Now, there is a potential game changer in the fight against colon cancer. A promising study published in the New England Journal of Medicine found new blood test is able to detect 83% of colon cancer tumors. Now, this news comes as colon cancer is the third most common cancer and the second leading cause of cancer-related deaths in the U.S. Well, joining us this morning to break down everything we need to know about this disease is Dr. Thomas Mazza with Lexington Medical Center. Thank you so much for joining us this morning.
Thanks for having me.
All right, doctor, we got to talk about this. What is colorectal cancer for those who may not be familiar with it?
Well, colorectal cancer is a growth inside the lumen of the colon that is an abnormal growth of cells that continues to enlarge, grow without any kind of checks or balance, and it can lead to bleeding, obstruction, perforation if it's not caught early.
Okay, so what are some of the symptoms of this cancer that people can be on the lookout for?
Well, that's the whole problem with colorectal cancer is oftentimes the symptoms are not present at the early stages of the disease. So most of the time symptoms would be bleeding or abdominal pain, change in bowel habits, and oftentimes that's late in the progression of the disease.
Now, I also want to talk about this. So new cases of colon cancer among people under the age of 50 is rising at what some doctors are calling an alarming rate. I think one of the most in the spotlight examples of that is actor Chadwick Boseman. We know that he died of colon cancer at just 43 years old. And so can you talk about the trend that we're seeing and this being seen in younger adults?
Well, they've shown about a 1% increase per year since I think 2015 or so. And it's not all attributed to, but a big part of it is screening early. We changed the screening guidelines to age 45 in 2018 because of the increased prevalence of younger people with colorectal cancer. For the most part, it is a more prominent disease in older population.
Now, I have to ask this too. When it comes to screening for this, are colonoscopies still the gold standard for this?
Well, the short answer to that is yes. It's the gold standard. It is the most sensitive and most accurate study to evaluate for colorectal cancer. And the great thing about colonoscopy with regard to colorectal cancer is it can find growths in the colon called polyps that have the potential to turn into a cancer. So colonoscopy is a preventative tool as much as it is an early diagnosis tool.
As somebody who is works with this on a daily basis, what's the biggest thing that you want people to know about colon cancer?
It's preventable, and it's relatively easy to prevent by just doing routine screening for the population. And colonoscopy is really not that bad of a thing to go through. Yes, it's a bowel preparation to flush the colon out, but as far as the procedure itself, it only takes about 15 minutes to do. You're asleep for the procedure, you're comfortable. A few complications associated with the procedure. And if it's done on a regular basis, every 10 years for average risk individuals, it can really, save people's lives, prevent them from getting a cancer.
So that is the biggest thing that I'm really taking away from this is the fact that we can be proactive when it comes to colon cancer. So get those colonoscopies, talk to your doctors. Dr. Mazza is a very great example of the fact that, hey, listen, this is not as bad of a procedure as it sounds. So thank you so much for joining us this morning.
Thank you for having me.
All right, friends, we'll put this on our website, WLTX.com, so you can reference it again. But again, my friends, make sure that you are taking care of your health. Don't avoid those appointments because you think it might not be something you want to do.